had no idea that NP school would have been so difficult. I'm like, yeah, I've been a nurse for 10 years. I think I'm pretty good. I have a good foundation. I should be good. Boy, was I wrong. Listen, I'm going to tell you 5 things I wish I knew before I decided to pursue my career as a nurse practitioner. Now, for all of you who are new to my page, welcome. It's your favorite NP mentor here. Just a little bit about me. I have my DNP. I have my adult gerontology primary care certification, and I also have my acute care certification. So enough about me. Let's get into this video. So the first thing is there was so much information to learn. Now, I worked primarily in cardiac. I did cath lab, I did cardiothoracic surgery. Yeah, we did balloon pumps, impellers, LVADs, ECMO, all that good stuff. Cardiogenic shock. So what ends up happening is when you're working in these specialties, you tend to forget a little bit about medicine. So I did a little bit of medicine when I did agency. I did med surg for a little bit. I would have some med surg patients with my cardiac patients sometimes, but my medicine foundation honestly was pretty weak. So now going back from inpatient critical care specialty to outpatient primary care, that was a huge difference, to say the least. Now, one of the problems that I encountered was that, in the hospital, you're so used to having access to everything, right? You have someone who has chest pain, you do an EKG, you do troponin, you call cardiology right away if need be. But how do you manage someone who's having chest pain in an outpatient basis? How do you manage someone who is hypertensive and you've just ordered them nifedipine and they can't afford that medication? It's a great medication, but it's expensive if you do not have insurance. How do you manage these patients who have chronic comorbidities, but they either have no insurance or their insurance coverage isn't great and they end up having to pay for a lot of things out of pocket? This was challenging for me because in the hospital, I never really cared about if someone has insurance or if they don't have insurance, because guess what? There's billing. I don't deal with that. I just make sure that I was giving the medications and doing everything that was ordered and so forth. But when you're working outpatient as a provider, now it's very different because you definitely need to make sure that you develop individualized care plans for this particular patient. The last thing you want to do is order a bunch of medications that this patient cannot afford, and that patient will just take the prescription, go to the pharmacy, and the pharmacist will say, hey, it's $400, and the patient will say, oh, I can't afford this. Now that patient goes home with no medication, hypertensive, only to be admitted few weeks later with hypertensive urgency, right? People think that outpatient is so easy, but it really is not. It takes a lot more work. Now, someone is coughing, they are not feeling well, and you want to see if they have a pneumonia. A lot of times when you're working inpatient, you just order a chest x-ray. Now, if you're working outpatient and you don't have chest x-ray capabilities in your office or in the office where you're working, then you rely heavily on your physical assessment, right? And this is when all that advanced health assessment comes into play, because these patients will come to you and they'll say, hey, I need to have surgery on my toe and my podiatrist wants medical clearance. So now you have to decide, is this patient appropriate for medical clearance? If they have cardiac disease, you got to send them to a cardiologist. It's a lot of work and it's not easy, And one of the other things that I faced too also was, let's say you have a young guy, 35, 37-year-old male, no significant primary medical history, just coming in for a medical clearance for his job. No other history again. He comes in with a blood pressure of 190/110. And he's like, oh, I don't have high blood pressure. My blood pressure is normally fine. Like When was the last time you checked your blood pressure? Oh, well, I went to the urgent care one time for a cough and they checked my blood pressure. It was okay, but it was never this high. Well, now it is. So is this someone who you immediately start medication on? Do you send him away and have him come back? Do you not fill out his form? Do you understand what I'm saying? These are very different issues that you don't deal with when you're working inpatient. Someone comes in with a blood pressure of 190 over 110, bro, you about to be on some IV medication right now. You're gonna do blood work. You're gonna see if there is any end organ damage, if their kidneys are affected. Like you're gonna do the whole workup with the patient is already in the hospital. You're not gonna discharge someone home with a blood pressure of 190 or 110, right? But when you're working outpatient, it's very different. One of the things I will say is that working outpatient really opened up my eyes to the importance of individualized care plans. Of course, we do that inpatient, but when you're working outpatient, it's very, very different. And you may not have access to everything in your office, and then you have to make clinical decisions regarding whether or not this patient needs to go to the hospital, or is this something that can be managed on an outpatient basis. The second thing is that I did not network. I never really realized how important it was to network. Because when you network, your life will be easier, okay? So let's say you're in NP school and you pick a school that does not find a preceptor for you. Oh my God, you're in for it. Now, I worked in, again, cardiac surgery, okay? I was doing adult gerontology primary care. I ain't know no primary care doctors. It's like, even my primary care doctor is like, oh, we don't take NPs. So it's like, who do I know? I don't even work with primary care doctors. And the assumption that a lot of these NP schools have is that, oh, you work in a hospital, so you should be able to find a preceptor. Absolutely not. Like, I had a difficult time finding a preceptor. A, like I said, because I was in cardiac surgery and I didn't know anybody. And two, because I did not network. What do I mean by network? You have NPs that you might know, that you work with. You might have like lead NPs for a particular department or for a division of nurse practitioners. Make yourself known to these people and say, hey, you know, I'm in school. I'm going to be looking for a preceptor soon. I appreciate your help in helping me find somebody. If you know anybody that is outpatient or inpatient, whatever it is, you network, you meet people, you put yourself out there. Because when it's time for a preceptor, I know a lot of people who had to end up waiting an entire semester because they couldn't find a preceptor. Now, this is something, again, that I will stress. And networking is key. And networking is also key when it's time for you to find a job. Because there's a lot of NPs who get jobs that they are not qualified for. And the only reason why they got some of those jobs is because they knew the right people. Again, it goes back to more or less not what you know, it's who you know. Okay? So there were NPs that I knew had a job before they even graduated. Right? And that's because they were able to network. They set themselves up appropriately. So my advice to you is, while you are still in school or you're thinking about going to school, that you should 100% start networking, because it will make your life easier when it's time for you to find a job out of school and when it's for you to find a preceptor. Because even if you don't know anybody, there will be somebody that knows somebody else that knows somebody else that will be able to hook you up. So keep that in mind. And also, maybe if when you're looking for an NP school, first inquire, do they require you to find your own preceptor? Because that is super important, because now you know that that responsibility is going to fall 100% on you. And the other problem with that is that it cannot just be any old preceptor. So if you know someone that is in acute care that's willing to precept you, but you are doing primary care, that will not work. They want somebody in primary care, okay? So, which means that you have to find a preceptor that is also in line with the requirements for your certification. So that is what makes it even worse. Because, oh yeah, you find somebody say, yeah, I'll precept you, but I can't work with you because you're in acute care. I'm in primary care. They want me to work outpatient. So trust me, that is difficult. So third thing is the exams were pretty hard. Now, this was on some next level stuff. This isn't, oh, you know, memorizing and then maybe there's some application. Like to memorize it because you got to know it. You have to apply it. And then you also have to determine what you're going to do about this problem from a practitioner perspective. I found that when I studied the book and I got the exams, I'm like, what the fuck? I'm like, none of this stuff that I studied is even on here. I'm like, I feel like I'm in new grad all over again. So I had to figure out, how can I pass these goddamn NP exams? Like, I remember the first NP exam that we took in adult primary care role when I started clinicals. Every single person in that class bombed that exam. I was like, what the fuck? Like, how am I supposed to study for this? So I'm gonna give you a little hint. Get those review books, just like you did in undergrad where you had Saunders, right? You have some other people that can help you pass the class. And maybe that's not Saunders, but you have Leak, you have Fitzgerald, and you have Barkley. And it all depends on which certification you're studying for, okay? So that would be my advice to you. When you're taking on those kind of exams where they're asking for application-like questions, you should make sure that you 100% study those questions, because those questions that you're getting that's going to prepare you for your certification exam is very much similar to the questions that they're giving you in NP school, okay? And you sure that you practice, because you're doing this, you're studying, but if you're not practicing questions just like undergrad, you're gonna struggle. Okay, so I learned that the hard way. After my first exam, I was like, bro, I ain't gonna pass it. I asked if I get another grade like this. So I was like, I gotta get my life right. So I was on them books. Get them books when it's time to study, because those exams are no joke. And you need to practice questions so you can increase the likelihood that you're gonna pass. Enjoying my videos so far, please, please, please make sure you hit that like button and make sure you subscribe so you can get more information from moi. Anyway, let's continue. The fourth thing is balancing school with kids and work. Now, when I did the adult gerontology program, I didn't have any children, so I was able to go 2 days. I was able to work part-time and work 2 days a week on the weekend. But then in the DNP program, I had both my kids. And in the acute care program, my kids were 3 and 4. So that was pretty rough. Now, you will be pulled in all different directions, from needing to spend time with your kids. You have things to do with them, take care of them. And if you're married, you have a husband and you know he has his wants and needs also. So that's another responsibility. And then you have school, right? And work. Work can be very stressful. Sometimes you're tired and you have to come home and study for exams and do papers after you've put your kids to bed. It can be a complete chaotic situation, okay? And that is really what also makes it very difficult, is that you're trying to find a time to get everything done. Now, just a couple of suggestions here. One, learn how to say no. You haven't been able to spend time with that person because some friend or whoever, and you feel bad because you've been neglecting them, so to speak, because you've been studying. My advice to you would be, it's okay to say no, because all you're gonna do is overwhelm yourself. 1. 2, you have to be super organized. Time management is a must, okay? You get a calendar, write down everything that you're supposed to do, including take kids to soccer practice, whatever it is in your life that you have to do, exercise, cook, put everything in that calendar. And whatever you write down is a time for you to study and get things done, so that you see, oh, I have an exam next Wednesday, I need to do X, Y, Z within these 2 days. Get it done, okay? Because all what's gonna happen is you're gonna procrastinate, you're gonna get overwhelmed, and then you're not gonna do well. Okay, so time management and being organized is super important in this program. So I suggest that you get a calendar and you do everything I just said, because that will 100% increase your chances of doing well. Just saying. And the fifth thing is knowing what program to choose. I wish somebody would have told me that it actually did matter which program you decided to enter, depending on where you want to work. Because I knew so many people that were FNP or adult gero, primary care, working in acute care. So I felt like, oh, if I just want to switch to acute care, I can. Now let me explain. Some hospitals are very, very strict about making sure you have the correct certification for the department that you are working, right? So my initial hospital that I worked, when I went into CCU, they didn't care that I didn't have acute care certification. I had my adult gero, which was fine for them. But when I switched to the medical ICU, that was a different story, because there they wanted that acute care certification. So now I had to go back to school. Good thing it was a streamlined program, and get my acute care certification, right? After a couple years before, 2-3 years before that, I got my DNP. I was like, oh my God, I gotta go back to school again. This is the third time. I am so over it. But anyway, my advice to you would be, if you are interested in being a hospitalist, if you want to specialize, if you want to work inpatient, you should do acute care. If you like women's health, you like outpatient, you want to work in a clinic, right? You should do FNP. Adult, if you don't want to work with children, you don't want to work with pregnant women, you just want to deal with adults on an outpatient basis, or if you want to work like at a nursing home or something like that, strictly medicine, then do adult gero, okay? And in psych, again, if you like to deal with patients that have psychiatric illnesses, substance abuse, those kind of things, then you should go into psych. But my point is, you can't do adult gero like I did and then want to switch over to acute care. Why? Because it has to do with you practicing outside of scope. Now, your school prepared you, for example, if you did adult gero like I did, adult gero primary care, your school has prepared you to care for patients who are stable in an outpatient basis with chronic illnesses or acute on chronic illnesses, not unstable, about to die kind of patients that are acutely ill with acutely ill illnesses. The programs are set up two different ways, right? So although you have the certification to practice as a nurse practitioner, you do not have the certification to care for acutely ill patients. So that's one of my pet peeves about the NP program, is that it forces you to specialize, right? The PA programs, PAs just go to school, they come out and they can work wherever they want, right? NPs, oh, I did adult gero, now I gotta go back for acute care. Oh, I did acute care, now I wanna go to psych, I gotta go to psych. And you have to specialize. So that's one of the downfalls to choosing to go the NP route, is because it's very limited in your decisions to switch, because if you switch, you gotta go to school all over again. And some hospitals, like I said, they're not strict about it. But just so you know, if you are practicing in an area that your school has not prepared you to work, you are 100% practicing outside of scope. I was, but I had to end up going back and get my acute care for that reason. And also because my other hospital that I work at, they were like, oh no, you need acute care. We're not taking you unless you get it within X amount of years. Anyway, if you follow these tips, I think that you will 100% do well in the program. And if you want to learn a little bit more about what is a nurse practitioner, then you should follow this video here. I think that will help you. And if you also want to learn a little bit more about how to mitigate school with children, right? And then I have another video that you should also check out as well. I hope you enjoyed this video. Thank you. Bye.